A very good evening to the dedicated state team of Indian Medical Association Tamil Nadu State Branch, distinguished guests, and the future luminaries of the medical world. On behalf of Indian Medical Association's Medical Students Network and Juniors Doctor Network, Tamil Nadu State Branch, I, Lalita M., warmly welcome you all to the landmark event Araichi. Araichi in the Tamil word for research is not just a title, it is our guiding mission today, aimed at fostering a culture of inquiry and discovery. We would also like to take this opportunity to sincerely thank our respected state leaders of IMA Tamil Nadu, starting from Dr. P. Sengutuvan Sir, State President, Dr. K. M. Abdul Hasan Sir, IMA Past President, Dr. B. Sridhar Sir, Past President Elect IMA, Dr. S. Karthik Prabhu Sir, Honorary State Secretary, Dr. S. Gauri Shankar Sir, State Finance Secretary, Dr. R. Annamalai Sir, Chairman, Dr. S. Jamuna Rani Ma'am, Coordinator, and Dr. V. S. Hariharan Sir, Chairman. Each of these leaders stands as a beacon for excellence, and their guidance reminds us that every journey in research begins with brave ideas and bold questions. Their unwavering support enables us to chart new territories and make meaningful progress in medical sciences. Every advance in medical springs for a moment of curiosity, a question that ignites innovation. How do we choose the right topic? How do we build upon the existing body of knowledge? Most importantly, how do we innovate? Our session, From Choosing a Topic to Harnessing Innovation, is designed to address these fundamental questions. This evening's program will serve as a compass for every young researcher navigating the vast ocean of medical science. To guide us, we have the privilege of welcoming an eminent academic, Dr. R. Niveta, MD, Assistant Professor, Department of Community Medicine, PSP Medical College. Dr. R. Niveta's valuable contributions to community medicine place her at the intersection of public health, data, and medical research. Her experience offers a unique perspective on identifying gaps and designing studies that truly matter. Today, she will not only share her insights but also mentor us on transforming ideas into powerful research narratives. A special thanks goes to our organizing secretary, Dr. G. Arunagiri sir, and the entire organizing team whose enthusiasm and determination have brought this event to life. Without further ado, please join me in giving a gracious welcome to Dr. R. Niveta ma'am. Ma'am, the virtual stage is all yours.
Good evening, everybody. Thank you, Lalita, for introducing me to AARAICHI 2025 participants. And thank Arunagiri. And I would like to thank my all dignitaries in IMA for giving me this opportunity. As you all know, I am Dr. R. Niveta. And without any further delay, we will go into the sessions. Okay, all are ready? Shall we start?
Yes, ma'am. We are ready, ma'am.
Yeah. Okay. Before going into my session, let me plot certain questions. How many of you are interested in doing a research? Not yet started doing, but you are planned for a research. How many of you? Yeah, 1, 2, 3. Only 3 members. 4. Yeah.
Actually, everyone is reacting, ma'am. They are putting the emojis.
Okay, then. Okay.
Yeah.
How many of them are in the process of doing a research? I have been selected. I had written my protocol. I'm being stuck in the middle of the research. Okay. Okay. I am going to take a session on literature review. How we are going to do a literature review? The literature review process is not only a starting of a research. It should be done during your research. Review effectively. Okay. The objective of my session will be how to as already I mentioned, you are going to explore how to frame a research question or title using PICO or Spider's format, and also to formulate a clear hypothesis for your study, and learn how to conduct a step-by-step literature review techniques. Now let's go steps of literature review. The first and foremost important step is framing a research question. So, anyone having your research question ready?
Guys, you can unmute and you can interact with our ma'am.
Yeah, I wanted to say that this is not an one-day lecture. It is like a workshop. You are going to frame your question and hypothesis for your study, and a little bit of research literature for your research. If you have been attentive to this session, at the end, you can make use of this for other next upcoming classes. If you are not that much interactive with the session, then it will be of you are going to have a backload for this sessions for upcoming sessions. So you can try. Do you have any other research questions or research ideas?
Research team leads, you can unmute and can let ma'am know about your research works that you are doing right now. Or else, can I point out people, ma'am?
Yeah, you can.
Yeah. Mugia?
Yes, sir. Good evening, ma'am.
Good evening.
Ma'am, our research topic is advantages and benefits of use stress among medical students, ma'am.
Advantage and disadvantages of
Use stress.
use stress. Okay, nice. Okay. Some other thing?
There's lots of teams present here.
Okay.
Actually.
Okay.
Lalita?
We will discuss this research question in upcoming slides. Yeah, it's very good. You are having you all are having a research ideas with you. Okay. The first and foremost step is a framing research question. Why I'm saying it is the question should be very clear. Then only we can go to next step. If the question is vague, then your search and the result also will become vague. So the framing your research question will be an utmost important for a research. The second step is research, searching relevant literatures. How we are going to search a literature is using databases like PubMed, Scopus, and Google Scholar. So this step aims not only collecting the studies or articles, but by using some strategies which we are going to discuss in this session. Okay. The step 3 is after collecting the all article, you're going to analyze the quality of the each and every studies based on some checklist. I will include only this type of study design. I'm going to avoid this kind of bias in this selected studies. I'm going to select only validated and reliable question used studies. Then like I'm going to assess the quality of the study. Then only I'm going to get into, I will add in my studies. So based on that, we can create a good evidence for our study. Okay. The fourth step, here we are going to analyze and critically evaluate literatures. How we are going to do after selecting the studies and assessing its quality, we are going to look through the pattern of the study, or we are going to identify any gaps which been present in the study, or any contradictory statements which have been addressed by the author, or any recommendation what the author has been missed in the study. This will give us a clue for us to develop our research question, and we can modify our research question based on the analysis what we done with the selected question. Based on this, we are finally going to do a writing of literature review, which we are going to do in an organized and consistent way, where we are going to write in a storytelling way, what and all topics which have been known to us by previous study and which is not known and which we going to address in this research. Everything should be put into the literature review. Then we are going to conduct our study based on whatever we have been into the protocol. Okay. Just before going into the proper topic, I already addressed that every researcher has a vague research idea. Before starting any research, there will be one poking point where we will start with a rough, vague idea of research. This vague idea will poke you to go into a research, but we have to shape our research question in a meaningful way. Then only we can able to do a next step, that is we can search this in the literature review. So a good question, research question should contain 3 C's. It should be very clear. That is, whatever research question you are going to convey to others should be easily understandable. When you are telling that I wanted to do this kind of study, means they have to be easily understand. Then only they will be very interested with your study, right? Then it should be consistent. It should be kept to a particular point. It should be very sharp. That's this I'm going to do. This is not included in my study. That, like, you have to be very consistent with your study, and it should be very catchy. Yeah, it should be very interesting and very interesting only. Then you will also into the study, and other peoples who are like to study. If you have been published this article also, it should be catchy. Then only you will also be cited to other researchers. Okay. After writing this research question, yeah. Any volunteers? We wanted to say your research question.
Excuse me, Mama, I have a doubt. Can I?
Yeah, sure.
Okay, this is Manoranjani from Team 6.
Okay.
I have a kind of research question, maybe a research topic. I'll share out. Can you say your
Yeah.
perception on how to apply this?
Yeah, sure.
Okay. So it's about awareness and perception on pre-rehabilitation in cancer therapy among medical students.
Okay.
We have 5 more, like 4 to 5 areas. This is one of them.
Okay.
I'll repeat the topic.
Yeah.
Yeah.
You repeat your question,
Yeah.
please.
Yeah. Awareness and perception on pre-rehabilitation in cancer therapy among medical students.
Pre-rehabilitation therapy among medical student, huh?
Exactly. Yes, ma'am.
Okay.
Basically, rehabilitation therapy that is given in cancer.
You are from which medical college, doctor?
I'm from Government Medical College, Tiruvallur.
Tiruvallur. Yes, fine.
Yeah.
Your topic is clear. Yeah. You going to measure only the awareness and perception about
Yes.
pre-rehabilitation. Yes. It is
Yes,
also
ma'am.
very consistent and it is very interesting. But before you are going into, what type of study you are planning? What is your study design?
Ma'am, maybe a cross-sectional study would be easy, but this is actually questionnaire based.
Yeah. Yeah, it's a
But
good thing. Cross-sectional study.
But cross-sectional or pilot, a small cohort, that is a clarity we are actually
Cohort?
yet to apply.
Okay.
Yeah.
You are third year or final year, doctor?
I'm a pre-final year student.
Pre-final year student. Okay.
Yeah.
Okay. After completing the study,
Okay.
similar topic we will discuss. Okay.
Okay.
Your topic has these 3 C's. Okay. It is very clear. It is very consistent and it's also catchy. Okay.
Okay.
But if the question, we have to check another more. We have to check if the question is research worthy or we can able to apply for real world. It should be done with finance criteria. Okay.
Okay. Yeah.
This study is feasible, right?
Yes.
Can we able to do this study?
Yes, we can, ma'am, because it's we are applying in medical students.
Yeah. So it can be applied with your time. You have almost 1 year or 2 years of time to complete your study, or 1 year of time to complete your study. You don't want much money to do the study because it's a cross-sectional study going to have a questionnaire based, I think so. Then resources also very fine. So it is feasible and it's also interesting. It is exciting for you as well as me for seeing the study. And it's also novel. Is it a novel study?
Yes, ma'am, it is.
Yeah.
This sector is not very much focused actually.
Focused.
So after doing the proper literature review, that the way you said.
After doing this proper literature review, you can go into the study. And there is no any ethical issues in the study also.
Yes,
and it is also relevant because you are going to do in a medical students. which is easy for us to do, no?
Yes. Yes.
Then it's based on quantitative and qualitative type of study. What is mean by quantitative? Anyone? What are the types of studies you know, guys? Anyone? As already Manju said that cross-sectional study and cohort study.
Analytical, no?
Observational analytical studies, it's broadly classified into observational analytical study, observational study. In observational study, it is further divided into descriptive and analytical study. Then what else? Different type of studies, you know, guys?
Mixed method study, ma'am.
Mixed method study, very good. Mixed method means what you are coming to apply?
Actually, both qualitative and quantitative.
Qualitative and quantitative, yes.
Yeah.
So the study types is broadly classified into quantitative and qualitative. What else we are discussing, like observational, analytical, cross-sectional study, everything is measured in numbers. That is said to be quantitative studies, whereas what we were discussing now, like awareness, perception, these terms and all will
KP.
cover. Yeah, it's a qualitative kind of thing. So this should be done in qualitative format or qualitative methods. If mixed method means we are going to use both quantitative, one type of quantitative as well as qualitative. Yes? Okay. Now we will go to the same topic. What your friend was discussing, right? Awareness and perception of pre-rehabilitation among medical students. Can we frame this based on this PICO or SPIDER's format? PICO stands for population, that means population, intervention, comparison group, and outcome. This is PICO format. In this, I repeat, P stands for population, I stands for intervention or exposure, C stands for comparison group or control group, O stands for outcome. Whereas then SPIDER, there is sample, PIE stands for phenomena of interest, D stands for design, study design, E stands for evaluation of what thing in your study, and R stands for research type. To make you understand more, I'm going to give a quantitative study question. Based on that, you can say what and all components of PICO has been present in this question. My research question is going to be among school children's with among school teachers with type 2 DM, as following the low sugar diet compared to a regular diet, improve HbA1c level after 3 months. What is the population in this study question?
School teachers.
Yes, school teacher with type 2 diabetes. What is the intervention in this study?
Low sugar.
Intervention or exposure? Low sugar. What is the comparison group which is present in the study? Regular diet, comparison group. And outcome is HbA1c level after 3 months. Like this, you are going to reframe your research question. If it is a quantitative study, we are going to use PICO format for reframing your question. Okay? Like that. For qualitative, there is another question. What are the experiences of 10 school teachers with type 2 diabetes in following low sugar diet through a focus group discussion? Focus group discussion is one of the approach we are doing in qualitative type. In qualitative type, we are going to collect the data through focus group discussion or in-depth interview of the person. Okay? For a startup, you can know only these two formats. One is focus group discussion, another one is in-depth interview. In this, focus group discussion was due. S stands for sample. The sample is school teacher with type 2 diabetes. Our phenomena of interest is experience of following low sugar diet among them. And D stands for design. That is, what design we are using in the study is focus group discussion. E stands for evaluation. What we are going to test is perception of the teacher, challenges, and facilitation of the teacher to follow this low sugar diet. And RS, it is I should add a qualitative type of study. So research type is said to be qualitative study. Like that. Anyone please explain your study, reframe your study question based on this PICO or spider format, and can you explain to us? What happened?
Ma'am, shall I try, ma'am?
Yeah, sure.
Yes, ma'am. So basically, my study is prevalence of peripheral neuropathy in a type 2 diabetes patients. It's a comparative study between OHS and insulin taking patients.
Okay,
Ma'am. So
OHS or insulin patient. Okay.
yeah. So population is on.
Your study is a
It's a cross-sectional study, then.
cross-sectional. It comes into quantitative research type, right?
Quantitative research type.
Yeah. You are going to follow PICO.
PICO criteria. So populations on chronic diabetic patients.
Okay.
Is more than 5 years of diabetes history to those population, and intervention. So we'll be doing the interventions like peripheral neuropathy screening, ma'am.
Peripheral neuropathy screening in
Missing
insulin
neuropathy screening test we will be conducting. That will be the intervention.
Conducting in insulin taking patient, whereas comparative group is same peripheral neuropathy test will be done in OHV, that is oral hypoglycemic patients.
Yes.
Your outcome will be
who will be having the more prevalence of peripheral neuropathy.
So this is the format. If this 4 components is present in your study, research question, this will be very clear. By learning itself, you will get to know. If you are missing something, you can add location also. You are conducting in from Tiruvallur district, Tamil Nadu, or South India. That like we can add your location also with your research question. Okay?
Yes, ma'am. Sure.
Okay. I'm moving a little bit. There is a term called as hypothesis. It's a specific tentative statement where we are going to say there is a relation between 2 or more variables which we can test through our study. For example, our daily observations like people who exercise seems to be healthy. It's my observation. Every day we are seeing exercising people are very healthy. So I wanted to convert this observation into a research question. Okay. To make my research question, I'm doing this as a does exercise reduce blood sugar is going to be my research question. Whereas for testing, I wanted to make this research question as hypothesis. At times, I'm going to change this research question as regular physical exercise lowers the blood sugar among adults. So my observation will be people who have been exercising seems to be healthy. Whereas my research question is, does exercise reduces blood pressure? My hypothesis is regular physical activity lowers the blood pressure among adult. So hypothesis should be always specific and it should be testable. For example, I'm going to give an example that exercise is good for health. The same thing in another statement. Can we leave this as an hypothesis? Or we can make it more spicy. Exercising for how many hours or how many minutes will make the people healthy? Any WHO standards for doing exercises? எல்லாம் தூங்குறீங்களா?
30 to 45 minutes, ma'am.
Okay. So exercising 30 to 40 minutes. Going to reduce my BMI, or it will make my BMI into a correct appropriate normal range among some college student within 3 months of doing physical activity. Like that, I have to frame it based on my research question, and I have to address a hypothesis for it. The hypothesis is furthermore classified into two types. There are null hypothesis and alternative hypothesis. Already I have been said that hypothesis means testing. It's a test statement which which we can say that is a relationship between two or more variables are present or not based on our study. If what is meant by null hypothesis means there is no relationship or difference exists between two or more variables which are being into the study, and whereas alternative hypothesis is vice versa. Here there is a relationship or difference is present, that like we have to say. For better understanding, a simple example is coffee has no effect on exam scores in college students, whereas in alternative hypothesis it's going to be coffee improves exam scores among students. It was very simple example, right? I wanted to add more thing, like second example is a low sugar diet has no effect on HbA1c in adult with type 2 diabetes. Here a low sugar diet going to reduce my HbA1c in adult with type 2 diabetes. Okay. Okay. Yeah. An example for you. You guys going to say a research question for these both scenarios and hypothesis for this both. என்னாச்சு தெரியலையா? Can we try?
Yes, ma'am.
Mm.
I would say development of chronic lung disease. It is a comparative study between tobacco and non-tobacco users of developing chronic lung disease in a tertiary in a rural village. Yeah, I should add the 40 years and in rural village in Tamil Nadu.
Can you reframe it once again? Development of chronic lung diseases.
A comparative study between tobacco users and non-tobacco users on the development of chronic lung disease among adults
of more than 40 years
in a rural village.
Rural Tamil Nadu. Very good. Can you change this into an hypothesis? Easy. Tobacco users
are prone to develop
more prone to develop an chronic lung disease compared to non-tobacco users. Okay. Okay. Someone for second example. You make it an interesting session, pa. Most of them are pre-final years, right? You already know about hypothesis, everything. Yeah.
Hello.
Yeah, doctor, you can.
Sorry, ma'am, I couldn't join the meeting on time. I was actually boarding my train. Can you please give me a short introduction of what is going on in the meeting? I'm so sorry.
Yeah, sure. Yeah. You are pre-final year or final year, doctor?
No, ma'am, I just completed my first year. I'm in second year.
Second year. Okay. We are started about framing a research question. The research question should be very clear. Yeah. Yeah. Yeah, we were into the research question. We just started with research question. Your research idea should be a clear and focused research question based on these 3 C's. That is, it should be clear, consistent, and catchy, and followed by a finest criteria should be we have to follow a finest criteria, and based on the study design, we are framing a research question and hypothesis for the study. So you will get a pre-recorded session of this class. You can go through the steps. Okay. Yeah, we were into framing a research question and hypothesis for this part qualitative type, spiders type? Anyone volunteering?
Ma'am, can I try?
Yeah, sure.
For the qualitative,
Yeah, spider method, spider format. It should be question.
adult.
What on the
Sorry,
Mari?
ma'am.
It should be in a format like what on the Mari.
Okay, ma'am. Ma'am, can I get like a second to just, ma'am? So
Yeah,
what
yeah.
are the experiences, perceptions, and coping mechanisms of adults over 40 in rural Tamil Nadu regarding tobacco use and chronic lung disease?
Okay. Where is your study design and all? We wanted to fit this spider's criteria into your questionnaire. At least a 3 to 4 things should be in this question. Directly or indirectly.
Okay, ma'am.
A perception, attitude, coping mechanism among adult more than 40 years of age who have been experiencing related to tobacco use and chronic lung diseases through in-depth interview. That like we have to complete it. Okay.
Okay, ma'am.
Okay. Yeah. We were almost.
Hello, ma'am.
Yeah.
Hello, ma'am. I have a doubt, ma'am.
Yeah.
I'm Priyanka from Chengalpattu Medical College, ma'am.
Okay.
I actually don't know whether it's a quantitative or qualitative question, ma'am. I'll read out my topic.
Question. Yeah, definitely.
A cross-sectional study on pattern of substance abuse and degree of cruelty in crime caste.
A pattern of substance abuse
and degree of cruelty in the crime caste.
Degree of cruelty in crime
Cruelty.
caste.
Cruelty.
In
cruelty
caste.
in crime.
Cruelty in
the crime which is caste.
Okay.
Degree
Crime.
of cruelty in
Okay.
crime.
Okay. Crime.
And substance abuse.
Okay. After
So
searching,
is it qualitative or quantitative?
it should be mostly this kind of studies. You don't have much quantitative part, right? You should be doing it in a qualitative part. That will be very nice. In-depth interview of the substance abuser and when they are going to provoke and how they are going to the degree and all you are saying no. It is based on the.
Yes, ma'am.
It will be a qualitative type will be better for the study now.
Okay, ma'am. Ma'am, actually there is a standard criteria,
Questionnaire.
ma'am. Through that there will be a. It's not like a questionnaire, ma'am, like a criteria kind of questionnaire, ma'am. But that will be scoring for that also, ma'am. For finding the cruelness, there's a scoring, and then we'll assess the. We'll ask about the pattern of substance use, ma'am. Duration, what kind of drug and all.
Okay.
Yeah, we'll ask that, and then we'll give the scoring of their crime, ma'am.
If that's a component, you have a standard checklist for it.
Yes,
you can proceed it with the quantitative type of study. You are going to do as a cross-sectional study, so well and good. But if you wanted to make it as a mixed method study, that is, you can add a qualitative part like taking the insight about the substance abuse person into the study. That will be very good. Like quoting whenever they wanted to take. That like some questions we can't able to quantify, right? That questions and all we can poke through a qualitative type of questions. There are not only there is a in-depth and focus group discussion. The qualitative study is a big large thing. You can try a file sorting or free listing for your participants. This is a big chapter as a qualitative study. So make use. You just write and keep that as free listing and file sorting. Study about it. If you have any doubt, you can ping me.
Okay, ma'am. Yes, ma'am. Thank you.
Anyone wanted to discuss about your research question and hypothesis before going into a literature?
Yes, ma'am.
How to frame questions for this, ma'am?
Which, ma?
Or the topic which I said now. How
The
to
pattern
frame a
of
question
shooting.
for this one?
You can
Yeah,
use
yes,
spider
ma'am.
method.
Pattern of
You can use spider also. Da.
Yes,
Spider,
ma'am.
if you are going to do is in a mixed
Yes, ma'am.
method, you can do as a spider, or you are going to do only the checklist thing, you can use as a picometra. If you
Yes,
don't
ma'am.
have comparison group, we can leave that.
Yes, ma'am. No comparison group, ma'am.
Then you can use only population, intervention or exposure, and outcome directly.
Yes, ma'am.
You can leave the comparison group. Yes.
Thank you, ma'am.
Okay. Da.
Excuse me, ma'am.
Yeah.
Ma'am, I had the same doubt regarding the topic of my study as
Yeah,
well.
you can see.
The topic is, ma'am, prevalence of depression and anxiety and their associated factors among professional auto and cab drivers in South Indian population.
Okay, it's a clear cut, no? Clear cut question.
For quantitative, ma'am.
It's a quantitative.
Okay, ma'am.
If you wanted to know the insight, then you can add a mixed method study. You can ask an in-depth interview for any other questions, any questions. But there is some, with my knowledge, I am saying depression and anxiety is more common. More studies will be available. If you are going to do literature search, right? At times you will get to know more about the study. So you can directly go into depression and anxiety questionnaire. And associated factors, already you have lot and more studies. After literature review, you can get more associated factors. And you can add it in your questionnaire.
Okay, ma'am. Thank you, ma'am.
Okay. Some other questions?
Excuse me, ma'am.
Yeah.
Can I apply the previously discussed
Yeah, the awareness,
example
no?
over here?
Awareness
Yeah,
perception.
yeah.
If you have a questionnaire, you can go as a quantitative method, Rama. You have already having a questionnaire, right? Awareness questionnaire
Yeah.
or checklist.
Yeah, exactly.
If you have, you can go. Or else you wanted to do something new or add something new, you can add a qualitative part in it. This will make your article very much interesting. You know, already there were checklist irukna. There will be many studies related with this checklist, right? Yes, publish yeah. You have to add something new to your study, right? Or you have to address something new. At times you can directly go with the qualitative type and you can ask what is the perception of a medical student directly. They can say whatever. They can say something new which we can't able to address now. They can say something new, or some people does not know about it also. So that and all we can make a note in your study.
Okay, so whenever the qualitative is actually applied, can you put into spider-based study?
Yeah, you can. If you are doing mixed method, you can do as a spider.
All right, all right.
Yeah.
Okay, it's clear.
Yeah. Okay, shall we move to the next topic, or someone having any other doubts? Yeah.
Ma'am, I just wanted to get your opinion on my topic, ma'am, if that's okay.
Yes.
Actually, my topic is profiling key gut microbiota in children with
come again,
healthy controls.
Once again, please. Profiling
key gut microbiota.
Gut microbial biota.
Gut commensals in children with persistent constipation and healthy controls. Comparative observational study using selective culture and colony PCR, ma'am.
Okay. Okay. Can I ask one thing? You are a final year student or a pre-final year student?
I'm a pre-final year, ma'am. I'm Harish Surya from Bharat Medical College, ma'am.
Bharat Medical College. Very
yes,
good. I wanted to say something.
Yes, ma'am.
Did your research question able to check all the finest criteria?
Yeah, I just changed it to using the spider thing, ma'am. But
spider thing is for qualitative. Your point is full of almost it's going to be an experimental study. Yeah, you are going to get a sample and you are going to run in a lab.
Yes, ma'am. Yes, ma'am.
There should be a feasibility of doing the study.
Yes,
one fecal sample, normal fecal sample, at least it runs for about 100 to 50 in a private hospital.
Yes, ma'am.
Then your sample size. You are going to have a comparative study.
Yes, ma'am.
This will charge you more.
Yes, ma'am.
And if your college is interested in doing this study, then it can be easy. But you should follow only the SPICO type.
Okay, ma'am. So if I were to change it to the PICO type,
Yeah, you should.
Gut commensal profiling in children with persistent constipation versus healthy controls. A comparative study using selective culture and colony PCR.
Yes.
Okay, ma'am. Thank you, ma'am.
Okay. Okay. Shall we move to next step? Okay. Okay. Here comes our topic of interest, literature review. Anyone are new for literature review? This is my first session to know about literature review. Or already all are through in research literature? Okay. In a simple way, I have to say something. Literature review is not just reading an article. Okay? It is a critical summarizing of existing research of your topic of interest. I repeat, it's not just reading an article. We are going to critically summarizing the existing research articles which you are related to your research question. Why we are keen of doing this research literature is, the first and foremost thing is to identify the gap in current literature or current knowledges. So if you identify this gap only, you can make your study better, and you can justify this is the gap I have been identified with this current literature. So I going to address this in this my study. So my study is going to be an unique study. Based on this, identifying this gap and justifying the study, I'm going to reframe my research question. I have been started with a research question of something, but end up after doing the literature review, I got something new idea. So at times I have a I have a concession that I can change my research question and hypothesis, then I can move on to my study. Not only this, I can spot more difficulties and pitfalls and weakness in other studies. These pitfalls and weakness can also even occur in our study. So in order to prevent these kind of difficulties in our study, we have to note while doing this literature review. And sometimes the standard methods can fail. Some studies will notify this, and they say some alternative procedures or alternative treatment which will be more effective, that like they will mention that we can introduce into our study also. And beyond that, the literature review also gives some practical details like using modern equipments or study tools in sense questioners, like already say some people were addressing that there is an already mentioned awareness checklist for know the perception of medical students, or there is an already available standardized tool for depression scoring, poor sleep quality index. There is already a study tool which may known or may not known. By doing this literature review, we will get to know about more type of study tools. Then different type of softwares we can be using for data collection or doing statistical test or some other procedures. Whatever procedures they are doing, they can be added in this different type of softwares. They can be mentioned in your different studies. Then like experimental studies, they can mention the dose. Like already we were first using paracetamol only 500 milligram. After addressed after so many researchers said increasing the dose can help in curing diseases, they will increase this dose. So by experiment only, we are going to do the increase the dose and frequency of the taking medications. Everything will be in the research itself. We will take the inputs from the previous studies. And the most important thing is calculating the sample size for your study. You are all fine with your research question. The next comes how much sample you have to collect. This sample size we are going to calculate with the previous studies prevalence or mean which have been they have been seen. We are going to take that number as a reference, and we are going to calculate the sample size for your study. And then different type of statistical tests for the data analysis. We can note the test. There are more fancy named testers. So we can learn the test and we can write and keep. While applying your data analysis, we can use the same statistical method also. So in a short, we can say the literature review is learning from experience of many hundreds of scientists. So we can save our time and efforts. Like whatever they said, the same thing we are going to say is nothing good, no? So we are going to do something innovated. So more we are going to take our study valid and reliable and relevant to this community. Okay. So I'm going to introduce that literature review. So many people may be thinking literature review na ennapa. Most of you have been done the literature review for your studies, no? Some seniors. While I was in UG, I was in somewhere my pre-final year or no second year to third year transition period. I was doing a research on PCOD, like causes of PCOD and hormonal effects, mainly hormonal effects of PCOD. So at times, what I will do, I'll type my research question in the Google search engines. What all research articles I get, I'll collect and keep, and I will summarize the article, and I'll write in my ROL. There were no one to guide me to do a literature review. So many of us, even some of the PGs will, at first starting of their career, they will do the same. Many people think that collect the articles, write the summary, and give is said to be a literature review. But that is not in a case. So it is more than that. And there are two components of literature review. The first one is information seeking. This we all will do, definitely. We will go search a literature review systematically using a manual search or a computerized databases like PubMed, Scopus, Google Scholar. You ever heard about these words? PubMed, Scopus, Google Scholars, database?
Yes, ma'am.
Yeah, good. In order to identify whatever useful articles and book we get, not the random things, whatever we search in the Google search engines we are taking, we are going to do a literature review manually or computer based in a systematic way to collect these articles. So the first step is done. What we will do, cook பண்றதுக்கு முன்னாடி we will know all the right ingredients la. So pasta பண்ணனும் முடிவு பண்ணிட்டு, if I don't have pasta, only I have seasonings and white sauce. I am ready with white sauce and seasonings, but I don't have pasta means it won't be very tasty, like that. Before starting, we're going to do the information seeking. The second most important, the real backbone of the literature review is critical appraising. The ability to carefully evaluate each study is more important. Before selecting a study, we have to ask ourselves a question. This study is an unbiased study or not? It's a valid study. Can I trust this finding? Can I include in my study? It is a good journal or predatory journal. That like we have to ask so many questions, and after that only we can take this article or study into your literature review. So I just wanted to say repeatedly that literature review is not just collecting an article and summarizing. It is furthermore like you have to critically appraising each articles before you have been adding it into your literature review. So there is before you are I am into the topic, I wanted to know you that if this is the question, what is malaria, where you are going to search about it. It's a basic knowledge question, right? If someone asks what is malaria, what will be your answer?
Bloodborne disease.
It's a
caused
disease
by Plasmodium.
Okay, can you say the reference that for this disease which is caused by Plasmodium? Where you have been get this knowledge?
Apurva Sastry.
It's a textbook, right?
Yes, ma'am. Yes, ma'am.
Yeah, it's a basic knowledge question. So you can address through your textbooks. Yeah. What if this is the question? What are the current advances in the treatment of cerebral malaria? This question is more advanced, right? Compared to a first basic question.
Yes, ma'am.
Where you get this answer? It can also get in
internet, ma'am.
Yeah, internet. Recent articles or reviews which is given by the scientists, you can get. So as the question gets deeper, your search going to be deeper, right? If this is your question, which is more effective treatment for severe malaria, artesunate or quinine? It's look like a compared to research type of question. Where you're going to search? Or
PubMed, Google Scholar.
Oh yeah, it's the database. You are going to search PubMed, Google Scholar. What type of studies you are going to search? It's like a clinical trial, no? Experimental study. Giving an artesunate or a quinine to two kind of peoples to say it's effective or not. So based on clinical trial report, I'm going to say which drug will be a good drug, right? So far, you know about textbook, journal, websites, search engines like Google, databases like PubMed, Scopus, Google Scholars. Okay. We're going to search something in an appropriate place that will help us. In general informations, we will search directly into the web search engines like Google or HON certified site. If anyone heard about HON certified site? What does mean by HON? Any idea? It's nothing but a Health on Net Foundation, which is a non-profit organization like WHO, which is started in Switzerland. It just give an online health information, a quality online information. Rather than our Wikipedia, this website going to give us a good sort of good health, online health information. So you can try it. Then trusted medical portals like WHO, these websites, Tamil Nadu government websites, everything will be general info search. Whereas in specific queries, there is a PubMed, Scopus, Google Scholar databases. In general or a specific, even in, I'm going to teach today about only PubMed. In PubMed also, not all the articles are free version. Fully you can't able to access. Some are in paid form. So I'm going to see only the free open access journal. If it's more important for me to quote that article, I can rent it and get. In some medical college, private medical college and government colleges also, more librarians has the paid version of PubMed, Scopus. When you are going to do a literature review, if there isn't any central research lab in your institute, you can make use of the paid version of your libraries. That is PubMed and Scopus, they have been paid. You can go and access the free paid articles also. Then the most important and most advanced high quality evidence will be seen in systematic review, meta-analysis, evidence-based research, coherence library, map of medicine. Just heard about, just get to know about these words, and this will be useful in future. But today's session, I'm going to teach you in a PubMed and free access only we are going to see. So just before going to start this literature review, I wanted to add same thing which I have been previously said. Like literature review is not just reading randomly. It's a systematic and organized process. Like looking this image, first and foremost is I'm going to collect and organize the information which is related to my research question. If I'm not collecting, it is just a background reading. most of the time I not only myself but also my all of our researcher will take the article, we read, but we don't take any notes. We will keep that article. We will miss that article if you are not collecting it. So the first and foremost, I'm going to collect and organize the article. If the article is good, I'm going to collect it, or else I will leave. Next thing is, while reading, I'm going to notice some gaps or lacunae in this research, where the researcher cannot able to address in this research, or any conflicts evidence present in this research gives me an opportunity to explore in my study. So not only organizing the information and collecting information is important, by reading it, we have to able to identify the gaps present in that article. And synthesizing result. Synthesizing means I'm not going to do summarizing of each articles. This scientist, this result is came. That is, I'm going to not summarizing this, going to summarize the result. What I'm going to do is, I'm going to collect all different studies in that research question. I'm going to compare this and highlight what is already known and what is still not known. At that point only, I will get a research gap. Based on that only, I am going to develop a question. So my final aim is to make my question or make my studies in unique form. So it's a step-by-step process. You already, I think you already have a vague research idea. Now, after this literature review, you're going to what? You're going to add the or reframe your research question and going to proceed with your unique study design with identified gap, which we can make your study as a novel study. Okay. So we are into the study. There are 4 principles in PubMed search. I just wanted to repeat this. There is a 4 principle in PubMed search. The first one is word search. Next is combined term, Boolean operator or advanced search. Then field search. Then mesh term. Everyone are with your mobile phones or laptop with you? Yes, I will do. Yes, kindly repeat this. Okay. We are going to have a demonstration on it. First one, I'm going to type PubMed in your Google. PubMed. Okay. After typing this PubMed, I'm going to get this type of window in this. In this, I'm going to do a search. I wanted to learn about diabetes. Diabetes, I'm searching it. This is called as word search. I'm typing diabetes, I'm searching. There is almost 3 lakhs. Okay, one sec. There is almost, how much zeros are there? 10 lakhs studies related to diabetes. There is a filter over here. Like while ordering Amazon, Flipkart and all, there will some filter, no? That like there is some filter customizing your filter. This bar shows some studies from starting 1788 to 2026 or 2025, almost 26, which are going to publish. Every studies are present. So I am going to filter last 5 years study. Okay, this has been much more reduced from 10 lakhs to 3 lakhs. Even that, I'm going to filter only free full text articles I'm taking. So free full text means
Ma'am, the screen is not visible.
Yeah, my screen is not visible.
Screen is on the presentation.
Google screen is not visible, ma'am.
Oh, Google screen is not visible. Okay, Okay, now you are able to see my screen?
Yes, ma'am.
Yes, ma'am.
Okay. I'll start from first. I'm going to type PubMed. Okay. In Google. Then I get a PubMed site. Into it. There is this type of screen will be visible. In that, I'm going to type only diabetes. And search. 1 second. So for searching only diabetes, I landed with roughly about 10 lakh studies, 10 lakh and rough studies. So I am going to filter it. Here is a filter. As you all, I already said that like Amazon order, like we will have filter, no? That like we have filters. I'm going to filter it for last 5 years. See how much it has been reduced from 10 lakh to 3 lakh. Even I'm going to only see about only free full text articles. From 3 lakh to 2 lakh. See, it is reducing. Then I'm going to see only diabetes study in clinical trial. See, only 6,670 results are found. It's good, right? Yes, okay. Yeah, this is word search. Word search means simply we are going to PubMed. We are in search bar. We are going to type whatever we need and we get thousands of results. But can you able to learn 617 articles? It's difficult, no? Shall we add more spices to it?
Yes, ma'am.
Okay. I wanted to introduce you to Boolean operator. It's a combined term search, which is an advanced search. Yeah. Can you able to see my screen?
Yes, ma'am.
The screen is in PPT, right?
No, ma'am. In the PubMed index.
Okay. I have to change. Full screen. Now?
Yes, ma'am.
Okay. We are in PPT, right?
Yes,
okay.
ma'am.
We are going to search through a database. The Boolean operators are 3 types. And, are, and not. You know Venn diagram, no? In Max. Like that. If I am adding and to my database, the brown circle is CKD studies database. Whereas in the blue circle denotes the databases of hypertension studies. But if I add and, I will get CKD and hypertension databases for me to study. Okay? Can you get? By adding and, I'm going to get CKD and hypertension studies only. Huh? If I add R, I will get both CKD and hypertension. CKD or hypertension. So anything. It can be both, or it can be only CKD studies, or it can be only hypertension studies. If I do an advanced search, here I am going to add what are the synonyms of diabetes can I add? Or it can be called as, I'm only seeing type 2 diabetes, type 2 DM. Like that I can add synonyms. Some studies they will mention only diabetes. Some studies they will say hyperglycemia of the patient. Some study they can say type 2 diabetes. So I have to add synonyms word by R. And I am going to see diet. So I'm going to search this. So from almost 6,000, I have been screened the study 1,086 studies. Okay. By adding Boolean operator, I have been shortlisted from 6,000 to 1,000. Am I complicating things? The first thing I addressed is word search. Then I addressed advanced search, right? I'm going to introduce you to third search. It is called as field search. Here there is a box. So after finding the keyword, so my study's keyword is diabetes, the low sugar thing. No, for that questionnaire, I'm going to select only two keywords: diabetes and diet. So based on the diet and diabetes, I'm going to go to this database and going to select this. You see once. Can you able to see the Google web page?
Yes, ma'am.
After selecting PubMed, I got this page. No, everyone will be able to see this page. In this page, in Explore, there is a mesh database. I'm going to select the mesh database. See, mesh database. Here I'm going to type diabetes. What you're going to do means, in diabetes, it going to, in one word, it has all sort of things. It's going to club everything. See, it's going to say diabetes insipidus or something, or what else? Diabetes type 1, type 2, type 3, everything will be there. So I want diabetes mellitus. In this, we can able to filter also. In diabetes, I'm going to say take prevention control only. I'll take that. Or I'm going to restrict this with this mesh term. Or I can include the below hierarchy. See, below there is more and more terms, right? This everything will be into it. For example, I'll try with heart attack. See, heart attack is said to be myocardial infarction. In myocardial infarction, what words and all will come? Anterior wall MI, posterior wall MI. See, shock, ST elevation. Everything, what are the synonyms? Everything will be there. We can restrict with this term, or we can include these belowing also. I can restrict with this major topic, or I can add. I can not include everything. I wanted to include everything. So I'm going to, in my study, I'm going to add diabetes. Search. I want type 2 diabetes or diabetes mellitus type 2. I'm going to select this. In this, I'm going to add to search build. Okay. After adding, I choosing a Boolean operator of and I am going to add low diet, whatever, right? Diet. Diet la, I'm searching. Okay, carbohydrate restricted diet or low sugar diet. I'm going to add this. Okay. Next, I'm going to search in PubMed. Okay. After this, I'm going to filter this. 5 years. See, 100 and something. Only full text. See, it going to be 135. Only clinical trial. Only that. Can I able to read 34 articles?
Yes. Yes, ma'am.
Yes, it is practically. Or I can go with first 9 article. Yes. This like you are going to filter your. This like you are going to build your literature review, right?
Excuse me, ma'am. Ma'am, can you tell it again once again?
Yeah, I will repeat. Okay. First, I'm going to open PubMed. Okay. PubMed. After opening, I will get this like of search bar. In the search bar, I am going to type diabetes. I'm going to search this. I'm going to clear all the filters which have been added. After adding diabetes, I'm going to filter for what else you want, you can filter. 5 years, full text, clinical trial, whatever you want. Or I can need systematic review. Whatever you want, you just select. Based on that, you can search. It is called as word search and adding filters to your word search. Next comes an advanced level. Here there is a icon like advanced. I'm going into it. In advanced, there is some Boolean operator and, are, and not. I'm going to add diabetes. And hypertension. Hypertension is otherwise called as high blood glucose or hypertension or high blood glucose. Okay. And I want prevalence of diabetes, hypertension, but I don't want in pregnancy. I'm going to add pregnancy or pregnant woman. Pregnant woman, I'm going to avoid. So I'm going to add not. I need diabetes and hypertension. Hypertension synonyms is high blood sugar, and I don't need pregnant woman. So now I'm going to search. Yeah, I'll get some article.
Why it is hypertension and high blood glucose?
I want some say only high blood pressure. So previously I was saying that diabetes, type 2 diabetes, diabetes mellitus. I want to study about only type 2 diabetes. What else synonyms they can say in studies? Type 2 diabetes, type 2 DM, diabetes mellitus. That like they will keep on hyperglycemia. That like they will we will write no synonyms. And the mari all things we have to should add in R. In order to prevent this only, I taught you mesh word. If you are applying in mesh, you don't want to type everything.
Shouldn't we type high blood glucose after diabetes? Why after hypertension?
Okay, I'll type diabetes. No, diabetes synonyms what, ma?
Hyperglycemia.
Hyperglycemia. Diabetes and hyperglycemia is the same term, no? I can add it as an in R, right? Not and, no? You understand what I'm telling? R. Then I wanted to study hypertension, right? So I'm going to add and I'm going to add hypertension. Okay, and hypertension. Hypertension is otherwise known as high blood sugar. So I'm going to add with R. Okay.
Okay.
That's another mesh.
High blood pressure, ma'am.
High blood glucose. No, sorry, pressure.
Okay.
Yeah, sorry.
That's why I confused. Thank you.
Okay. This is an advanced search. We can add field to the advanced search, that like based on the title or full text. There is full text, mesh words, everything will be in the field also. We can add field. Mesh words also we can add here. But the easy thing is go to PubMed. Under Explore, there is a mesh database. Here we can type whatever you want, like diabetes. We're going to search here. I want a type 2, particularly only type 2. So I'm going and select that. If I wanted to study about ethics, the ethiopathology, epidemiology in this diabetes, I can add epidemiology or prevention and control. What else I need, I can add in mesh terms. Okay. Any doubt in this?
No, ma'am.
Ma'am,
Oh, yeah.
we can directly go through this mesh step, ma'am.
Yes, you can go.
Okay.
It's easy, but you have to know the steps now. So only.
Okay.
Okay. To repeat this, there are 4 type of principle in PubMed. The first one is word search. We are going to directly into the search bar and we are going to type and we are applying in all field. In combined terms, we are going to use Boolean operators like and, or, and not. Based on that, if it is an and, it's going to be a narrow search. If it's an or, it's a broad search. If it is a not, it's going to exclude from your result. Then it's field search. We can add title, abstract, full text, everything to your search. Then is the last and most important thing is mesh word. It's going to give controlled vocabulary terms from the mesh database. Okay. Now an example for you. Kindly do it for me. And tell me how many articles you are going to retrieve from your PubMed. எல்லாருக்கும் பசி வந்துடுச்சா? ஆளே காணோம். இது என்ன ஹோம்வொர்க்கா? ஒண்ணு ட்ரை பண்ணலாம். இந்த ஒரு क्वेश्चन மட்டும் ட்ரை பண்ணலாம். வாட் இஸ் தி எஃபெக்ட் ஆஃப் physical activity? அட்லீஸ்ட் மெஷ் டேர்ம் மட்டும் வச்சு பார்த்து பண்ணுங்க. physical activity, depression and adolescent. இந்த 3 தான் கீவேர்ட். மெஷ்ல போயிட்டு ட்ரை பண்ணுங்க. physical activity, depression or depression disorder, whatever. Depression and adolescent. இந்த 3 term தான் keyword. Go and try in mesh word. Mesh. Let me know the result of articles. How many articles?
Ma'am, we need to search all 3 all together, ma'am.
What, ma?
Do we need to search all 3 together?
Yeah,
ma'am?
you have to search all 3 and you should add in the build. You're going to search this physical activity. Physical activity will be seen in exercise. Yeah, it is seen in exercise, right? You can select exercise. You can add to build and you can type depression. Depression. Add to build. Then teenage or adolescent. How many articles?
660 articles. 665.
Okay. 5 years or 1 year. 1 year, it's around 126. You can filter it. So 83. Only 6 articles for clinical trial. For systematic review. So we can filter based on it. Okay, you got this idea, right? Okay. After doing this, இதெல்லாம் பண்ணி முடிச்சிடலாம். பண்ணி முடிச்சோடனே you are having almost we were in around 36 or 40 what I was doing, diabetes and diet. It was around
34.
34. After getting all this article, what are you going to do? I will read, no? I will read all the article, which and all quality article I will collect. I will compare the methods, result, findings, everything. And I am going to tabulate it. Okay? இப்படி ஒரு table போட போறோம். I already done for you. I am going to table it like this. From a descending years, like the order. 2018, 20, 21, I am going to add. I am adding citation, study design, the objective of my study population, sample size, outcomes, and what author has been concluded. This like I'm going to add. Based on that only I know which is important study, which is not important study. I can avoid or I can take it. Or what limitation this author having given to the study or recommendation, which may be very useful for our study, no? So like that, I am going to tabulate it. So the writing literature review is an art. There are different types of or formats of writing. I'm going to introduce 3 formats for you. First, I'm going to write some introduction, like what is my purpose of literature review, what is the importance in my study, and what is the recent advances from important to least important. Or someone will write from earliest, what I have been mentioned, from earliest 2018, 20, 31, and from earliest study to recent studies. Like they will write an introduction with the studies. And after checking their quality, each studies should be quoted after paraphrasing, not directly quoted. Abstract எடுத்து copy பண்ணி paraphrase-ல போட்டு அப்படியே எடுத்து ஓட்டிடக்கூடாது. You have to understand something. So what the strength and weakness of the studies before adding, you have to know. I'm going to show what else I have done with 3 types of literature review. The first method I already showed to you. I did a study on post-menopausal bleeding and cervical cancer screening. So, நான் review of literature எப்படி பண்ணியிருக்கேன் பாருங்க. ஒரு ஸ்டடியா எடுத்துக்கிட்டேன், டைட்டில் வைஸ் நான் போட்டிருக்கேன், எந்த இடத்துல பண்ணியிருக்காங்க, எந்த வருஷம் பண்ணியிருக்காங்க, what are the types of study, setting. As a community physician, I need to know it's an hospital based study or a community based study. So அது எவ்வளோ samples எடுத்திருக்காங்க and what are the major findings I have been enlisted. So ஒரு 24 ஒரு எனக்கு இம்பார்ட்டண்டா பத்தின ப்ரிவலன்ஸ்ல ஒரு 4-5 ஸ்டடி I have been written. And then causes என்னென்னலாம் causesன்றதுக்கு I have been written 24 studies. இந்த மாதிரி I can able to summarize my literature of review. We can present it in the same way also. It is summarizing. It's one of the type. Tabulating the literature of review, or we can write based on author wise. For example, prevalence of postmenopausal bleeding. I am going to divide the studies into international studies, national, that is Indian based origin studies, and state-wise or Tamil Nadu, state-wise studies, district-wise studies. In the Mari, I am going to divide the studies in 3 different entities. Then, author by author, I am going to explain the study. For example, first author and et al. Has been done the study in Denmark in 1990 and their findings. Then another author. Like that, I am going. National-wise studies. From Chhattisgarh one study, from Jharkhand one study. That like I'm selecting the studies and I'm putting into a rough heading like national studies. Then state studies. Like that, I am going to write a literature review author-wise. And there is another one format is called as thematic review of literature. I am going to write the themes of my studies. These are the headlines I am going to discuss in the study. Means I am going to study about the burden of pulmonary tuberculosis, or I am going to know about the success and barriers in the tuberculosis. I need to focus on tuberculosis control in vulnerable population. Like that, I am going to write the themes, what and all themes I have. I wanted to study in the study, and I am going to segregate based on the themes, all the studies, and I'm going to write the studies in under the themes. I don't going to mention the author name and all. I'm going to mention that this study, the tuberculosis incident in India is this much. This much in mortality is seen in the in Pakistan. Like that, I am going to mention everything in that paragraph. If I wanted to know about the burden of the disease in this area, I am going to know not only in Tamil Nadu but Pondicherry is a union territory. In district wise, if I have a data, I will include in that paragraph. If something like source and barriers in every study, the need for focusing on tuberculosis control in vulnerable population. This everything, almost this first paragraph contain almost 10 articles. 10 articles I go through and I got what and all factors they have been mentioned. I have put into one paragraph. So that like we can write the thematic. I have been introduced you to 3 types. One is table form, another one is author-wise, and third one is thematic literature of review. So first you're going to frame your research question. To summarize the session, first, the literature review is not just summarizing, but it's critically analyzing and synthesizing of your studies, which you have been already known, and identifying what is missing. That is identifying the gap. And second, we discuss about research question from moving from your vague research idea to a focused research question using these 3 C's and finer criteria. Then, based on the study design, the frameworks for the studies will be done by PICO or Spider's format. And then hypothesis. Hypothesis is very specific and testable, measurable statement. Here, there is 2 types of hypothesis, null and alternative hypothesis. For searching strategy, we used PubMed as a tool. In that, we had 2 terms, Boolean operator and mesh terms, which will be helpful for our effective literature review. Thank you. Before concluding my session, I would like to extend my thank to Indian Medical Association Tamil Nadu chapter in association with Medical Student Network and Junior Doctor Network for giving me this opportunity to interact with the students. And my heart welcome thank you for the organizing team of AARAICHI 2025 for providing me this opportunity. And finally, I'd like to thank all the students and young doctors who have been participating. And it's almost a dinner time. Everyone has been alert in this session. And I hope this workshop will help you in your research, in upcoming research. And wish you all success in your research journeys, students. Thank you.
Good evening, ma'am.
Good evening.
Respected dignitaries, faculty member, organizing committee, and my dear fellow participant. On behalf of the organizing team of AARAICHI 25, it is my privilege and honor to extend a heartfelt vote of thanks. First and foremost, I express our sincere gratitude to our speaker, Dr. Nivetha ma'am, for gracing this occasion with your presence and inspiring and enlightening us on from choosing a topic of harnessing innovation. Your insight on literature review, topic selection, and research innovation have truly given us a clear direction in shaping and strong research. I also thank our organizing secretary, Mr. Arunagiri sir, and IMA-MSN coordinator, Dr. Jamuna ma'am, whose constant support and encouragement made this event possible. My heartfelt appreciation goes to the organizing committee, whose meticulous planning and untiring effort have ensured the smooth and successful conduct of this event. I also extend my thanks to all the participants and presentees. Your active involvement and scholarly contribution have added immense value to this event. Last but not the least, I thank each and every one of your valuable presence, and I look forward meeting you all in the future edition of AARAICHI. Thank you. Thank you, ma'am.
Ma'am, thank you so much for this amazing session, ma'am. It was very informative and interactive, ma'am.
Thank you.
Thank you so much, ma'am.
Thank you, ma'am.
Looking forward for you all.
Thank you, ma'am.
Thank you.
Sure, ma'am. Ma'am, could you please share your PPT with us, ma'am?
Yeah, sure.
Everyone got amazed by your PPT as well, ma'am.
I'll share it.
I'm getting lots of DM from the participants.
Okay. I'll share it.
Yes, ma'am. Thank you. Thank you so much, ma'am.
Thank you.
Thank you.